To fully benefit from learning to use the skills, it's recommended that you attend a comprehensive DBT program. A comprehensive DBT program requires you to attend at least one time per week for your individual therapy and one time per week for your skills class. Don't worry if you don't like attending skills groups or anything like that. DBT skills classes are set up and structured more like a classroom setting, and it is not a process group. Hello, I'm Kim McFarland, and I'm a National Certified Counselor from the state of Michigan. I'm here today to share with you some common questions that I get as a licensed professional counselor who practices dialectical behavioral therapy, or it's more commonly referred to as DBT. One of the most common questions I get is, what is DBT? DBT is a transdiagnostic therapy. This means it can treat a wide variety of diagnoses or mental health disorders. It was originally developed by Marshall Linehan to treat borderline personality disorder. However, since then, researchers have found it's very effective for treating anxiety, depression, substance abuse, some eating disorders, and even some schizophrenia with emotion regulation skills. DBT is a dialectical approach, meaning that there's more than one way to look at the world, meaning that two polar opposite viewpoints can both be very true at the same time. So dialectical means that you can have this idea, and both of these ideas can be very, very true. So that means there's more than one way to solve a problem, and it's all about finding a middle path, because living in extremes isn't always helpful. So we want to bring you back here in the middle and find a way to balance things for you. DBT does a great job of helping you find the middle path. It allows you to be able to not live in an extreme of being overly regulated or overly under-regulated, but it allows you space to balance both of those extremes and to find that middle path and to balance dialectical thoughts. So what does DBT incorporate? DBT incorporates a set of skills that helps you learn how to get to the middle path. You attend a skills class to learn mindfulness skills, emotion regulation skills, interpersonal effectiveness skills, and distress tolerance skills. Along with your skills class, you also attend your individual therapy sessions, and your therapist can help you hone in on using those skills in your natural environment and can help you figure out ways to practice those skills outside of the office. Together with individual therapy and skills classes, you learn how to start finding that balance, how to reach that middle path, reduce your vulnerabilities, reduce your distress and your emotional pain. So DBT does require a time commitment. To fully benefit from learning to use the skills, it's recommended that you attend a comprehensive DBT program. A comprehensive DBT program requires you to attend at least one time per week for your individual therapy and one time per week for your skills class. Don't worry if you don't like attending skills groups or anything like that. DBT skills classes are set up and structured more like a classroom setting, and it is not a process group. Generally, a comprehensive DBT program lasts for at least 1 year. This gives you ample time to learn the skills, to practice the skills, to identify barriers to using skills, and it introduces you to the skills more than once. So you get a whole year of being integrating those skills, of using those skills in your natural environment. And to effectively learn DBT, you need to practice your skills outside of the therapy office. I cannot stress this enough that practice is what you need to learn DBT and to be successful at using skills. Often when we're learning DBT skills, it seems like these skills are super easy. They can be easily applied outside of the office. However, you really have to practice these skills when you're not in the middle of a crisis, or you're not in the middle of a stressful situation. You want to practice these skills so they become very automatic for you, that they pop up to help you be more effective. Learning and practicing the skill in the office is one thing. Taking it outside of the office and learning to do this in your natural environment is a whole nother thing. And that's why I cannot stress enough that you have to practice these skills. And you have to practice them all the time. So that way, when you do get distressed, you can automatically use the skill, because when you do get worked up and you're not used to practicing them, the last thing that you're going to do is going to go open up your workbook and flip through your workbook trying to find skills to use and how to use them successfully. So again, practicing these skills in all aspects of your life, and you have to practice them 100% all in. I cannot stress that enough. You want to practice them so much that they become very automatic for you. Of course, we want your skills to become automatic. The more skillful you are, the quicker you can recover. And the more you can recover once you're dysregulated, the faster you can become more effective with making decisions and doing what you need to do in a situation to not make things worse for you, to either maintain where you're at or to make things better, to reduce your emotional suffering, reducing your emotional pain. And of course, all of these things together really do help reduce a lot of suffering and pain, and can help you, succeed at getting your goals met and to reach those life worth living goals. Thank you for joining me in this video. I hope you found this information helpful. If you have any questions, concerns, or comments, or any questions that you would like to see answered about mental health, counseling, DBT, please let me know. Please like and subscribe, and stay tuned for our next upcoming video.